She came to my OP and she came in a wheelchair and she was abusing me. I didn't realize what, she's alive and she's all right. I was very, very aghast at that point of time. And after that, and she started crying.
You said you were doing some tough cases, difficult cases, challenging cases. In urology, stones and prostate make the bread and butter. They give you new clients, they give you a bulk of patients, but the challenging cases, they give you a kick. At the same time, a personal satisfaction which few people want to have. What is the cost of that kick? AINU is the brainchild of Dr. Mallikarjuna. How difficult is it for you, or how challenging is it for you to keep your other colleagues and associates as busy as you are?
As I said, my life has gone to 3 decades now. Initially, it just happened. One was the struggle for existence. And the next 10 years has gone by struggle to excellence. The third thing is going to be is trying to a stage of establishing it.
Let me talk about someone who is an inspiring character to me because he's also a urologist. He has served as a source of inspiration to more than 3 generations of urologists in the country. He is well known for his exceptional work in laparoscopy and reconstructive urology. He has been a past president of Urological Society of India at national, zonal and state level. He is so popular in surgical workshops that the halls are all full when he operates. I'm talking about Dr. C. Mallikarjuna, who is the Managing Director of AINU, Hyderabad. And today, we are going to dig and dive deep into all those scars which he has on his body and soul, because behind that inspiration, there is a lot of perspiration, as he says. And I'm going to talk about all those struggles and hardships which he had endured and which has shaped into what he is today. Sir, finally we are here. and you have no idea, sir, how overwhelming this is to me. Sir, I am from Hyderabad. I never had to look beyond Hyderabad for an inspiration, as a urologist and as a surgeon. So, sir, I'm not going to talk about your success stories. I'm not going to talk about how good a surgeon you are. Everybody knows it. But I want to explore and I want to dig and deeply dive into those struggles and hardships which have shaped you into what you are. Because we all know it's not a bed of roses. Okay. So the questions are going to be brutal.
So it should be an unseen side of mine.
Absolutely, sir. Absolutely.
Which I need to recollect now.
Sir, I'm sure they are not forgettable, sir.
No, they can never be unseen sides. Most of the time, the seen sides are, the success things are mostly forgotten easily, but the things which fail you are never to be forgotten.
Understood, sir. And agreed. So, sir, let me straight away get started. How privileged was your childhood, or how difficult was it?
Well, I don't say that it was difficult. Difficult is not for that days. I think I'm not as bad, but at the same time, I was not really privileged. And
Okay.
in fact, my father was a junior engineer at the time in irrigation and department. So
Okay.
basically, very honest officer of those days, and we were living on the salary what we used to get.
Okay.
And for that moment, at that point of time, probably I'm talking about 60s or 70s of 1960s and 1970s. Okay. I think we are fairly decent enough to have a house or a house which is given by the government as a quarters and is able to fund our education into the schools, though I read all through my life in my ZPI schools or government high schools only all through.
So you mean to say you are from a Telugu-medium background?
Yes, of course. Till 10th class, I was in Telugu-medium only.
Then how difficult was the transition from Telugu-medium to English-medium?
Well, the transition was, in fact, I said, my father was too honest. So I know all my 10 classes of 10 classes of the first 10 classes, I read it in one place of each. So I read in Maipadu, I read in Nandyal, I read in Kalahasti, Guntakal, Srisalem, Hyderabad, Rajbhavan school in that gully near Rajbhavan.
Okay.
So all these places where I've been roaming around. So I said at that point of time, for that moment, they are able to fund my education, though in a government school.
Okay.
So we were not starving. So that itself is a great boon asset at that point of time.
Agreed, sir. Agreed. Because an 8-year-old child, he doesn't know what a Rolls Royce is and what a Maruti 800 is. For him, being able to go to school without the need to think about their financial woes of their parents itself is a privilege.
That's it. You may not get luxury,
Yeah,
but your basic necessities are met with.
Fantastic. He doesn't know what a 75 rupees shirt means and what an Armani shirt means.
You are wearing a shirt.
That's it.
There are so many people who are not wearing a shirt on the road.
Fantastic. So I'll take it as a privileged childhood with not much of a luxury, but yes, you were allowed to study and do nothing else. Yes. Fantastic. Yes. Okay, sir. So you said you're from Telugu-medium background and you went to intermediate or 11th or 12th and probably you went into English medium. That's also okay. But medicine is taught in hardcore English and medicine is not taught in any other language. How difficult was MBBS first year? Let's talk about anatomy or biochemistry because it's not easy, sir, even for an English medium student.
No, I differ a little here.
Please.
You see, we all look at what is the difficulty we are categorizing as difficulty, able to read in English.
Correct.
Or translate yourself from English to your own mindset.
Correct.
And able to write on paper.
Correct.
Am I right?
Correct.
These are the three aspects what we look at. Kada?
Correct.
So if you look at these three aspects, reading, it takes a little more effort.
Okay.
So it is not unachievable. You may be taking 10 minutes time if you're reading in your mother tongue like Telugu, and you may take 15 minutes time when you start reading it in English over a period of time and shortens over a period of time. So it is only a time constraint, nothing more than that. So that extra effort is necessary.
Okay.
Second thing is going to be understanding it. Oh. Understanding entirely depends upon the passion at which you are reading into it.
Yes.
If you're really reading with passion, irrespective if you're without passion, even your mother tongue you will not be able to understand. With passion, you should be able to understand even if it is difficult in English itself. Correct. So that's the second point. Third point is going to be translating it.
Yeah.
Translating is not because of language, how much you understood it. So that is actually the acceptance of the whole transfer of into a translation. So the only difference in the whole cycle is only that extra effort you try to make yourself to make understanding that English from mother tongue to English, that extra 50% of the time, which as the time passes by will start coming down. So first thing is extra effort initially, which is not necessary later.
Yeah.
Number two is going to be having a passion when you are reading, which can understand, make you understand.
Okay.
Having understood, you don't put an effort to really translate it.
100%. 100%.
So I don't think there is a big difference in the whole thing, except there is an initial struggle probably. Most of the time, which I see in my life is most of us who are translating from that, not because we cannot put that struggle, we are underconfident of our capabilities. So what makes those children, I feel, who come from that English or a translation, but coming from one group of education to the next group of education, like English medium to Telugu medium to an English medium, is mostly a lack of confidence in them that they can as well compete with the rest of the boys also.
Agreed, sir.
So if you have that confidence, this is not a big deal.
Okay.
I felt definitely difference or difficulty in my ability to read for longer times, but there was a problem. But anyway, your vocabulary becomes a little limited. You have a limited vocabulary into which everything explanation comes. You may not use big words of English, and possibly a limited vocabulary, you will be able to put it back into the public very easily. But anyway, it's not a hindrance. Anyway, a speed breaker only.
Got it, sir. So MBBS from Tirupati, then MS MCH from Chandigarh. Okay, you're all set with MCH degree. So did you think the world will welcome me with red carpet, or did you not expect those struggles once you came out, and how difficult was it to enter the real world after your education?
Thankfully, God has been very kind to me in one aspect, wherein I never had any breaks during whole my education. I finished my schooling and my intermediate in Tirupati, and then got into a medical seat immediately, so SVMC. And the end of, before I finished my house residency, I finished my PG entrance for Chandigarh, and I got into it. And immediately after my house residency, I joined into PGI. Immediately after my MS, I got into senior residency in general surgery, which is the most coveted post for training purpose. And I spent some time on that, and then joined urology. And then till that time, it was a smooth transition, though without much of expectations. I never aimed at something happening. This should happen, but it went on. It went on without with efforts to succeed, but at the same time there was no time gap. Most of the time, what hinders you at the time is a lag which comes in and which makes you quite depressed. That never happened. So till that point of time, it was great.
Okay.
I never expected that it will be a bed of roses. And if you look at I passed out in 1990 as a urologist PG in PGH Chandigarh. 1990. This is 36 years ago. 36 years ago, what was the healthcare industry in India at that time? Nothing. Basically, it was some pure private, few nursing homes where visiting consultants were operating, and government hospitals which are there inside the government, under the government sector, and everybody was having a job in government hospitals. So there was nothing, a carpet was never laid out. There was no carpet at all. There's no fabric of a carpet at all there at that point of time. So you realize that you come out, but you're not sure what you're going to do. You're still not clear what you want to do.
That's a fix.
Am I right? You see, you cannot, you are trained, okay, fine. I've been trained in a good institution where I'm capable of doing it. I'm very confident in my abilities because I worked as a senior general surgery and I did in a unit, one of the best units at that point of time for urology training. So I'm super confident in my abilities, but I don't know what to be done with that abilities on the ground because there's no opportunity for me to do. Where was the opportunity? There was no opportunity. I never expected it to be a bed of roses at all. Absolutely. But I realized if I can't find anything in the next 2 years and if I cannot sustain my family within next 2 years with my requirements, in which case I'll move to the Middle East, have some money at that point of time. Because by that time, my father is retired. And as I said, he's such a honest man. And that we were living with the pension money of my father. When I came in, he retired in 1988 and I came to Hyderabad in 1990. And I was living with a 5,000 stipend at that point of time in PGH Chandigarh. So I thought even if I get 10,000 rupees in Hyderabad at that point of time, I'm happy enough and I can sustain my family because I don't need, my house is there and I don't need to do anything beyond and luxuries need not be there at that point of time. So that was my thought process when I came in. But when I came in, I didn't find anything, no opportunity at all. In fact, I was never interested in the private sector at all. I was so interested in my basic concept was teaching and explaining the surgical was my core ability at that point of time.
Which you are actually doing even now.
Yes, of course. Now I'm taking my inner this thing coming out, and I'm trying to satisfy myself in that, which I thought of doing at that point of time. It's
on full-time basis.
On full-time basis, but I never had that opportunity because my brother, who was an engineer, he went to US before I finished my MCH, and I was forced to say I'll stay with my with my parents, and I came back to Hyderabad, and I didn't find anything here. I went to Nizam's, asked for a fellowship or small senior residency, but they said there is no post.
So the job scarcity was even there in 90s.
Job scarcity was nothing now. It was only there at that point of time. The government sector jobs were limited and they were all filled up already by that time. There were no new jobs coming up. There were no big hospitals. There were only 3 or 4 whole big hospitals having a urology department that time. Gandhi and Usmania, none else. Nizams. These are the 3 hospitals only who had urology department at that point of time. And all their posts, whatever are there, are full. And you need to go through a government selection. You need to go through that process. There should be there should be advertisement, and so many things will happen, right? I don't know. I didn't even apply, so I don't even know the actual processes. But anyway, that was not available to me. I went for Nizams to get into a senior residency. That was not available to me. So I was left with nothing at that time. And then it so happened that one of my relatives were getting operated by Dr. Saharya, our super senior in PGH Chandigarh, who was a transplant surgeon at that time. So I went and met him in view of that patient, and he said, why don't you come and join and assist us?
Where was Dr. Saharya at the time?
That was in Mahavir Hospital at that time. So Mahavir Hospital, that's how I started off, and I assisted him. So the first salary, probably not a salary, the surgical fee what I got was 400 rupees.
For a transplant assistance.
Assistance for a transplant. And I'm very happy for that. I was very happy for that. And I told my wife, look, this is my first earning, at least on the ground in Hyderabad at that time.
From Dr. Saharya.
From Saharya. And I always say, I learned a lot from him at that point of time during my stay of 6 months with him. But after that, so in view of not post, somebody told me that you can apply for a pool officership, which was established by ICMR, under ICMR, Indian Council of Medical Research,
Yeah,
to
yeah.
get the brain drain which is happening to outside countries. They were asking those people to come back to India. They used to give a pool officership job, and then they used to be placed in some of the teaching hospitals
Okay.
for that 1 to 2 years till they can establish into another job.
So a post was created to retain Indians.
The Indians at that time, it is still there. I don't know whether it is still there or not. It was there at that time because people after post graduation, people were going away. So
Okay.
they wanted to retain. The government jobs were not there. So people who have gone to England or US, they wanted to come back.
Okay.
So there was some post called pool officer. That means they were working under a department in a teaching hospital, and the ICMR used to pay somewhere around 6,000 rupees per pool officer at that point of time per month. So
Just higher than your stipend in PGI.
I'm fine with it. So
Okay.
I was so happy to get that, and I got selected for it, and I went back and joined Usmania department as a pool officer at that time.
Okay.
So it was not a bed of roses, but it was struggle for existence.
So this indirectly answers my next question, which was like, how imperative was you to work and make a living so that you can sustain your family?
It was very much needed.
Okay.
I already had a son already by that time who's going to a school, and my parents are already retired, and that's the only thing. So whatever I earned, that's the only way to sustain, and I realized it very well. But anyway, that didn't bother me because I never expected luxuries, but everything was unfolding as the time passes by. So I was happy with that.
Yeah, yeah. So the moment you stepped out, you got into pool officer post, and you also started doing some freelancing.
Yeah, that was actually the starting point of thing. A school officer post, and I started working in Usmania, which exposed me to a great number of clinicians in Usmania at that point of time. So many anesthetists in the departments of anesthesia.
Okay.
They used to love my abilities at that time. They used to love my confidence in my subject, etc. So they led me to get exposed to every nursing home possible in Hyderabad at that time.
Government hospital led you to freelancing.
That's exactly. Well,
Irony.
obviously, that was the only thing at that time. There was nobody else. You
Okay.
see, whosoever is practicing outside in city,
Yeah.
were all practicing or were working in teaching hospitals in the day.
Okay.
And the rest of the time it was happening in the night. That's how the evening clinics were there most of the time.
Okay.
So they led me to get exposed to so many people in Hyderabad, doctors, nursing homes, people. So that exposed my name, which I was a newcomer to Hyderabad otherwise.
Okay.
So that exposed me to so many people at that point of time. That helped me to establish myself with my abilities anyway, whatever it is.
Yeah, yeah, got it, sir. So, sir, even in the current era where people like me, I'm not freelancing anymore. I used to do it in the past, but people like me or younger guys who are freelancing at this point of time, they find nursing homes or the neighborhood hospitals quite inadequate for an adequate patient outcome. The work is more or less substandard because of whatever the reason may be. The difficulties were much bigger in your days, I believe.
Of course.
But how could you freelance for almost 10 years? Because I read in your CV that you freelanced from 1990 to 2000. With the difficulty of an inadequate equipment or manpower or people with lesser abilities around you, working in a freelance environment is a daunting task.
I tell you the other way, Harsha.
Sir.
When you are struggling to exist,
Okay.
all those things are not seen. They start seeing once you're feeling that you're no more struggling. So the difficulties are felt only when you have adequate things. If you are
Okay.
inadequate and struggle to exist,
Okay.
those are never found as difficulties. They are day-to-day rituals which will get you to succeed in that struggle. So
That's
the first 10 years, it was true. It was so that I was carrying all my equipment, including diathermy, including glycine for TURs, everything. One of
3
my-
liter bottles.
Yes, 3-liter bottle in my dicky of my car, along with one assistant to assist me.
Which car you were driving at that time?
Maruti
800.
800.
Okay.
So,
Okay.
and so I used to carry all those things to every part of Hyderabad, to every nursing home.
Okay.
And luckily, I could make a good outcomes to every fair I operated, and that least complication rate possibly at that point of time, and that made the difference into my practice. So people started calling me. For that moment, I tell you, majority of the times you're looking at two aspects here.
Okay.
Number one, how much struggle was there to move around?
Correct.
Okay, as I said, that question I answered saying that if you're struggling, you don't feel it as a struggle.
Yes.
Only when you have an adequacy, you will not. The second point I tell you, which drives you more often, was your aim why you are struggling.
Okay.
Are you struggling to make more money? Or are you struggling to get more experience and your mark into the society?
Got it.
If you are trying to make more money,
Okay.
you become very, very rigid in your whole approach into the whole practice.
Got it.
But if it is, I need some patient to operate. I don't care if I get my money or not. I don't mind that. I don't mind. Even I may do it free of cost. But is this patient ready to get operated by me? That was my approach at that time. Am I getting work from morning to evening? Am I able to do 2-3 cases, out of which one may pay me? Doesn't matter. If the rest of the two can give me whatever money they can have, but I should have an opportunity to operate a person,
Okay.
which is my passion to do. So if you have that approach, you start enjoying it.
You have led me into my next question.
These are the two aspects of the same question I said. One, you
Got it,
look
sir.
at this way.
Yeah,
The
yeah.
other way, you look at in this fashion.
So you have led me to my next question. When you said you were ready to operate free of cost, I heard you did your first 100 laparoscopy cases free of cost. Was it a necessity out of learning or out of curiosity to learn laparoscopy, or inadequacy of the equipment, which made you feel that you may open up a laparoscopy case probably more often? What was the reason? Why did you do the first 100 cases of laparoscopy free of cost?
You said laparoscopy cases, you did 100 cases, you did free as
Yeah.
well, I'll before I answer that part of it, come to the previous part of it.
Okay.
What I'm saying is that part is based on my decision making at that time.
Okay.
About laparoscopy cases. But what happened previously, between 1990 to 1998, I am talking about, where was my sole aim, as I said before also, was to operate as many patients as possible.
To get better at your work.
I am to get better at what my fulfill my passion, continue to practice my passion.
Okay.
And number two, prove that I am credible enough.
Okay.
That was the main thing. Money became the byproduct of my work.
Agreed, sir.
So I never worked for money,
Okay.
rather than I wanted work for which whatever payment was happening was never bothering me at that time. I tell you, in Satya Kidney Center, when Rambupal started, Satya Kidney Center, I got associated with him with the same patient whom connected with the Saharya at that time.
Okay.
So Rambupal saw me in Mahavir and said, why don't you come and join as a urologist in Satya Kidney Center? Well, there was no concept of full-time urology there at that time, so he asked me to come and join. Okay.
Concept or the need?
There was actually a need, but the concept was not there, with
Okay.
neither with the consultant nor with the owners or anything like that. So
Okay.
I used to spend all my day, after my pull officership of 1.5 years, I used to spend all my day in Satya Kidney Center.
Okay.
So I used to see so many patients, every person, whosoever is walking. That was only kidney center at the time. It was very famous at that time,
Yeah.
and the significant amount of workload was there. So I tell you, there were a hospital package for a URS, that is a small ureteric stone, was 3,000 rupees.
3,000 pounds.
3,000, that's all.
Okay.
You pay that the package, 1 day admission in the general ward, 3,000 rupees, you finish.
And we are talking about an era when there was no orchestra.
There's no orchestra at that
And concept of health insurance was unknown.
No, none of that thing. So patients, Rambupal was very famous. From his village, people will come with a ureteric stone. They want to get operated. So Rambupal used to give the patient to me. If the patient is having, I said, how much you have? If you have 3,500 rupees, I'll operate you. 3,000 rupees I used to give to the hospital, 500 rupees I used to give to the anesthetist, and 3,500 I may not get anything, but I used to operate. So I used to have 13 to 14 cases a day at that point of time being operated, but still, I used to get majority of the times were free, or payments were so meager, or equal to the anesthetist, or 500 rupees or 1,000 rupees. So the passion was to do as many cases as possible than making more money.
Got it.
So money became the byproduct of it. So this was the initial era which gave me a lot of credibility. And patient, even today, those patients come now and tell me, you helped us at that point of time, they still remember. It makes me very good. But at the same time, I feel, damn it, you felt that I've done great thing to you, but you made me establish myself.
Agreed, sir. Agreed.
That is one thing which we need to look at.
Correct, sir.
Then coming to laparoscopy part, with the second part you asked me. In fact, you see, as I said, again, what is your passion? Two is practicing urological surgery, right?
Yeah.
So money becomes the byproduct of practicing this passion.
Okay.
Okay, money has to come by byproduct.
Yeah.
How do you update yourself? So there is urology was ever changing specialty in the last 3 decades. You know it very well.
Yes. Yes.
Every first 10 years was endourology.
Yeah.
I learned endourology by moving away and say that you come, I'll operate. I don't mind even if you don't. So my endourology got better.
Reaching the doorstep of the
Reaching
patient.
step. So the next what happened was my laparoscopy. Laparoscopy was evolving, and I felt that I was never been trained into laparoscopy. I never had any laparoscopic experience. It's all hearsay or a conference somewhere, a remote conference in AIMS, which was happening. One laparoscopy surgery case is done.
Okay.
We didn't have so much of YouTube knowledge at that point of time, so everything was
It did not exist.
to exist. So then I realized that I need to start my laparoscopy at one point, somewhere or other. So where do I get it? I'm not in a government sector. I can't experiment with anybody else. So I have my own patients. I had a fair, decent practice, God saving, at that point of time.
Okay.
So I have to experiment with my own patients.
Okay.
I may not do much harm because I have my abilities to convert and clean it up and do a proper end result at any point of time.
Okay.
But what I need is, I may spend a lot of time. I need some equipment. There is a capital expenditure involved. There is a hospital bill which goes up because I started learning. So that is a basic reason why I had to sacrifice all my surgical fee, though charged as a surgical fee, to the hospital so that I can learn with that extra time being spent on the patient. So fortunately, with my open surgical skill, which I already had, laparoscopy took somewhere around 50-100 cases of learning curve, wherein I sacrificed all the surgical fee so that I can complete the case without a botheration that I have to finish this case, otherwise the bill become mounting or something like that.
Yeah.
Fortunately, I had a good rapport with my hospital administration also, so they were clean enough saying that, okay, we'll cap the bill at this point. We may not charge. So they were courteous enough to allow me to practice in that fashion. So that is basically why I've done it, to learn. So again, around the passion for your subject. So whenever there is a passion that needs to be fulfilled or upgraded or continue to be lived with, or you need to excel in your passion, there is a sacrifice which is involved.
Got it, sir.
So that sacrifice, initial part was money in the endourology, again in laparoscopy. I had workload. So I had to sacrifice my money so that I can learn it on my own workload. So this is a way you need to evolve over a period of time. I don't know there is any other way to do it.
Absolutely. So you said you were ready to forego your professional fee for what you were doing. At the same time, how many times did any hospital or how many hospitals did they ever defaulted their payments to you? Did it happen? I'm sure it would have happened.
No, I don't think that sort of a situation exists. Sometimes, you see, there are 2-3 types of things.
Okay.
Sometimes, one, there are so many places where I operated, remote place, I never went back again to take money. There was no UPI. Some cover has to be given to you at that point of time. So there's many hospitals where I haven't taken the money also for my surgical fee. I always had a shy feeling to accept any money. So I used to say, Baad mein le lunga, and I used to come away from the hospital.
Okay.
Sometimes it was happening, sometimes it was not happening, but it didn't bother me at that time.
Okay.
But there was some sort of a 20% of the hospitals, there is always, when I do that way, they try to exploit you at that point of time. So that was always there, and we accept it as a part. But ultimately, whether he exploited me for money, but he could not exploit my learning on the patient where I operated.
Agreed,
so
sir. Agreed.
That is an additional advantage what I had. But I know what set of a people is there and how do you behave in future. And the majority of the time, 60% to 70% of the times, I don't see anybody is that sort of a thing. We always have a negative feeling about an hospital administration, but most of the time, they also are business people. They also run a business. They want to make their money. They want to don't lose their money at any point of time.
Correct.
So I don't consider them as a villain-like thing. But basically, we also should understand that they also need to make money for the establishment what they have done.
So in this hustle of freelance practice, like doing some 10 to 12, 15 surgeries a day, going to far off places, how could you keep up your mental and physical health?
Well, mental health was getting rejuvenated as you do the number of the times.
Yes.
Physical health, well, that was the only exercise what I had, and possibly that was also this running around was making me physically fit, and that energy drive was there with me because there is something waiting for me. There is something waiting for me all the time. You're mentally sick or physically sick. There's not when nothing is waiting on.
Okay.
You always say that. You see, if you are nothing is waiting for you next time, next hour, you'll get mentally and physically sick. And we are not those people having done medicine and gone through that amount of rigorous, the 20 years of training and all. We can never keep quiet ourselves. Dolce far niente. That's an Italian saying, that sweetness of doing nothing. That means do nothing and sit down and think about thoughts. That's not easy job at all. Absolutely not. And majority of the doctors can't do that also.
Yes.
Because your thought process is different and your body mind clock is completely different. So, well, mental and physical health was not an issue. Well, sometimes I do get disturbed because of inadequate facility, somewhere a big case done and I get troubled. Well, that was part of the game and it was happening all through in my life. When then it happens, whenever you become too super confident, there is a God who's always say, yes, speed breaker will teach you that, come on, come back to the ground. You can also have problems like that. But what out of all this bargain, what affected was my commitment to my family. That was a thing which was, because I was leaving at 6:30 in the morning, coming around 10 o'clock, and that was one thing which I always regret in my life. If somebody says, what you regret in your life? I regret two things. One is I could not give much time to my family.
Okay.
For struggle. They accepted it because at that point of time, because it was my struggle to exist. If I can't, they cannot be happy.
And the kind of work you were doing.
That's, and number two, we didn't have anything to fall back on.
Yeah.
So that I can continue my life without doing anything also.
Yes.
So they accepted at that point. But I feel possibly they have accepted. The second point is I still feel bad about it. I would have been more organized, possibly given some time to it. For example, I tell you, I haven't attended a parent-teacher meeting of any of my kids. The only two times, both of them I've read in Gitanjali, Gitanjali here in Begumpet. And the two times I entered into that school was when I took admission to my son in 1990, when I came to Hyderabad. And when there was a school day function on somewhere in 15 years later, when my daughter was at 12th standard and was the head girl of the school at that time. So these were the only two times I could enter into that school premises. So I never attended a parent-teach meeting, nor their school days or any function. So that's a regret what I have all through my life. And I've expressed that regret to my children also many times, saying that I can't get back, but I'm ready to sacrifice that whatever extra earning what I had to get back that time, which I can't build to get back any further.
So it comes with a cost.
It absolutely comes with a cost.
Okay. So now let me take the audience to some human side of Dr. Mallikarjuna. Was this the reason that you started smoking?
No. Most of the time, at that time, the smoking was basically a heroism showing when you're in first year of MBBS. That was the most common thing which was there, and at that time I started smoking. Okay. That's another regret. I still feel bad. I told you, one of the regrets is I can't sell it, but it's too personal, so I'm telling you, I hate myself for smoking in the front seat of the car with my children sitting in the back seat with the window open. See, so much crime, right? Criminal you look now, and I feel...
No, sir. That's the reason I said it's a human side of Dr. Mallikarjuna.
So I still feel that is a bad thing which I have done. I can't correct it now. I'm ready to correct it, but I can't correct it now. But anyway, that was the reason for smoking. Was nothing reason. There's nothing to stress for me. But because I never had expectation. I'll get stressful when I have an expectation. Yes. I am in the baseline. Even 1 comes, it is an advantage for me. 2 comes, it is a bonus for me. 3 comes, I'm excited. 4 comes, I make a party and spend another 2 there. Okay. So this was the life which I led right from beginning. So I was never having an expectation which will allow me or which will give me any different feel. So. Okay. So smoking was not that. Smoking was basically the college heroism shows. That's all, nothing else.
So during this journey of freelancing and whatever it was,
No, first I stopped smoking 15 years ago.
Oh, so you're not a
I don't smoke.
So you are a reformed smoker now.
I'm 20 years now. 20 years now I don't smoke.
One more small personal question. And how bad a smoker you were? How many cigarettes?
I was very bad. I was 20 to 25 cigarettes a day.
Wow. That's a huge
That
number.
was bad.
Huge number. So, sir, in this process of
But one thing,
Yeah.
you did ask me, why did I stop?
yeah, I
feel
must
that-
ask you. I thought,
Then, see, the reason for it was feeling was a heroism, right?
yeah.
Then at one point, I realized I'm no more a hero. I can't be a hero also. So
Okay.
one of my very close friend, named to be another Chaudhary, I can take his name because he's no more. But anyway, he is very close to me. Since the day I came to Hyderabad, he was practicing in St. Teresa, and that guy was so fascinated with my way of work and this thing. Every open case he used to come and assist me for there his own learning, and it was needed for me also as a person who can hold my hand to stop because. Once upon a time, sometimes I become so fast in this thing. He's one speed breaker, which may say, "Oh, go slow, go slow."
You were a running horse.
So he was putting some sort of a brake onto it. So when another Chaudhary and my kids or his kids and my kids are in a similar age at the similar age group and similar fashions.
Yeah.
One day he had a chest pain and he was admitted into care hospital and he was advised angiogram. That was in end of February and March where exams were due. March and April were due.
Okay.
So he refused an angiogram and came back home, and all the friends called me up and said, "Arey, go and talk to him, get an angiogram, he may delay it or it becomes difficult."
Okay.
So I went to his house for a function. We had a movie to go. I thought we'll spend 1 hour. Me, sir, my Rama and went. We both were sitting I and my Rama there was another was sitting on the terrace of his house in the flats, and I was talking to him and saying 100 reasons why he should get an angiogram.
Okay.
100 reasons why he should get an angiogram.
Yes.
He could answer 101 reasons why he should not get it done now. If something is there, their children education will go away. They will not be able to take exam. Their whole thing, 10th class or 12th class, everything is going to happen now. And if something deranged here, their life is going to be spoiled. Come what may happen, I'll do it after their exams, their entry into the thing. At that time, I finished 4 hours of talking to him.
So he was in fact giving you a reality check.
Yes, exactly. So when I came back and sat into the car, I revised myself, saying that what all he said was true to me also at the same point of time.
It hit you very hard.
It hit me, and I still remember I was living in Begumpet in that flyover, what is there in Amrita Mall area.
Yeah.
I threw the last packet of the cigarettes in my pocket and never smoked later. So it not comes to you when it is impact is more when it comes to your own people.
Got it, sir. So during this journey of freelancing, you might have started building a team. So how difficult was it for you or for anyone to retain a right team member?
It's the most difficult thing is to retain the talent.
Okay.
Talent is, everybody need not be as passionate as you, as thoughtful like you, in the same breadth, in the same way of thinking.
Okay.
It may not be possible. But luckily, for me, it happened that people were there. Possibly, I was clear in my concept and possibly things worked out because they were also learning at that point of time. And it worked out. I don't say that it was the best things that can happen, but I fairly feel at this present juncture, what I am in, I feel that I've got the best team. I can't dream better than this at all.
Got it,
So
sir.
there is nothing a limit for it. If somebody is always, I'm one person who I will always say, if somebody who's along with me performs more than my expectation or performs better than me, I am the happiest man for that. I give all that opportunities to people who stay with me. Everything is open to them. But I judge their possibility, their abilities before I give that opportunity for them to show, because people can't judge their capabilities. They always presume that they are capable about, but in fact it may not be true. So if you give a person who is not capable an opportunity to expose himself, he may falter and it becomes less confident, and that is the end of it. So you need to be fair, that decent level of confidence that is judged by the other person as a confident man, as that you are a confident man, and an opportunity at that time will give you the best possible result, and that makes you super confident. And once you become confident, nothing drags you down.
Yeah. It's all about the mindset.
It's a mindset. So building that mindset needs somebody to judge you.
Okay.
So based on my training during my PGI days, possibly my attitude, and possibly I was able to fairly judge people what are their capabilities are, and always felt that I should be able to give them the opportunity at the right time.
So if these three qualities are given, loyalty, commitment, and abilities, which quality do you think is the most important for a right team member?
All are needed. One doesn't compensate to others.
Okay.
You see, try to understand. You may have a very loyal person, but if he's not committed or very not ability, you're unnecessarily carrying extra baggage with
He becomes a liability.
liability. It's extra baggage. It may not be a liability, you can call it, but
Okay.
it becomes an extra
Correct.
baggage to you.
Yeah.
But a fellow with a great ability, without commitment, is a liability.
Yes.
Is a liability.
Yes.
A man with a great ability, with no loyalty, to be get rid of.
Yeah.
So all three are needed. Loyalty is needed to a certain extent, commitment is needed to a certain extent, and abilities are needed to an extent. And all these things are, you'll become a better person provided you have all three.
Yeah.
If you can never be a better person if you don't have these three.
That's the glitch. Finding a
You'll
right
always,
person.
you see, there are 100 fellows who are absolutely the abilities are
Capable.
superfluous, but you'll not know all of them. Why are you knowing only few people?
Okay.
Because they were committed to a cause, they were loyal to a place. So
Yeah.
that makes their abilities to grow up and seen very well. But if it is not, your abilities will get you a little amount of superfluousness into your mind, and lack of loyalty and lack of commitment will never allow you to grow at all.
Understood, sir. Fantastic. So, from freelance practice to corporate practice, the transition happened in 2000s.
Yes.
Was it difficult? Was it easy? Please take us through that.
No, I think fortunately, you see, I've never made any decisions ahead.
Okay.
All the decisions were taken according to the situation existed there.
Okay.
So I was very happy in Satyakindi Center till some point of time, wherein I worked for 10 years there, and I was very keen, as I said, I was very keen on my teaching part of it. I want to do.
What was the opportunity to teach?
I was no opportunity. That was a frustrating part of it. That's a frustrating. So I was insisting and I was asking Rambupal to take a DNB course there. I'll employ. So he said, how can you take DNB courses? We cannot pay this, that, usual style of it. And I said, okay, don't worry.
Okay.
I'll create a department. I take people under me. I give salary to them.
Okay.
Apply for a DNB course from this institution. I'll allow people coming here. We'll establish a department. We'll grow the department in a different style. I'm talking about 1917, 97, 98.
Okay.
At that period of time, Rambupal initially said yes, and that made me to get Sambasura at that time, who was an assistant professor in No More, He's No More. I'm sorry to say that, but he was in Nizams at that time as an assistant. So I called Sambasura, who is common friend to another Chaudhary, and I said, come on, join me.
Okay.
We'll create a department.
So he quit his government job and joined you.
He quit his government job and joined me. But again, the practices become different.
Okay.
So somebody, even the hospital encouraged me, why do you want to work with him? Become an independent consultant. And that completely fractured my sincerity towards the whole institution, what I had for that last 10 years, basically. Because I was a de facto next nephrologist after Rambupal, though I was a urologist, because there was no other nephrologist after Rambupal. Even if he's not there in station, if there is a snake bite case, I used to come sit and start doing a dialysis with my advisor at that time, and the technicians used to start dialysis. So that fractured my confidence into the system at that point of time. So that is the time possibly we start looking at, come on, this is not a growth pattern here.
Okay.
Possibly if I need to grow, that the seed has already sown into me.
Yeah.
And I was waiting for an opportunity to happen. And unfortunately, my mentor, whomsoever I was there with, Rambupal, passed away in 2000 at that time. And that made me, anyway, I was baseless at the time. He was the only savior for me in that institution.
Okay.
And that made me to look around and say that, come on, I need to look into something else, wherein I can fulfill both my practice, which I already established to have a fair amount of practice in Hyderabad. I started my own clinic at that time to get my own patients, and I was quite busy, and I was sought after in many nursing homes. Still my freelance was going on. So I said, okay.
I heard you were a favorite to almost all the gynecologists in Hyderabad.
That was every nursing home at that time.
Every nursing home.
Every nursing
every
home.
ureteric injury, every bladder injury, Dr. Mallikarjuna.
Well, the available people were very less. And available is readily available.
And probably you were the guy who was readily available at any point of time.
At any point of time.
Yeah.
That's the only thing, no difference basically.
Okay.
But That's a time when I thought that I should get into some sort of a corporate style of work wherein people think in a different perspective, like a DNB program, or where I can fulfill my teaching or everything into that once I groom into that. Because for existence, I have to be in a private hospital. To continue my practice, I have to be in a private hospital. But to get into that sort of a teaching mode, I need some people to be there around. For that, only corporate can help me. So I tried my Apollo, they refused, they tried my level best. I was there in Apollo Amar and Saivani for some period of time. Apollo Amar, I was doing at the time a fair decent workload, as good as what they were doing in main hospital. So one of my, the guy who was in charge of the hospital, his name was, he was there, he was trying to get me into main Apollo to improve the practice in Apollo. But anyway, there are so many reasons why they never took me to main Apollo.
Yeah.
So at that time, so my thing is quite open. I need a place where it can be bigger. I can establish a department and I can have a teaching program in near future. This is what my aim was. And at the same time, Yashoda Secunderabad came into picture and Surinder asked me to come over, and that was a fair ground, I thought, and then I went and joined. So it's not that I want to improvise myself or do, but the necessity of fulfilling some more inherent passions what I had.
Apart from the clinical work, you also wanted
Clinical
to do
work
some
was
academic
anyway
work.
happening, yeah.
Academic work. And did it fulfill your passion to teach?
Yeah, of course. I at least started having a department wherein I had some people to work on. That was so my variety of workload was going on. At least routine surgeries were done by my other colleagues, and I was concentrating on much difficult surgeries so that I can be mentally too free to perform. Whether I can't be doing A to Z all the time.
Got it.
So at least the cream part of it I can be doing. So that fulfilled my technical or practice improvement, what was happening because of the department was happening. And then they took the DNB program, and the DNB people have started off, and till now there is so much of DNB program which is happening. Well, that is what at least and then everything started off with me doing tough cases, more difficult cases. My laparoscopic skill became better. I was called everywhere to teach laparoscopy. So inherently, I'm getting satisfied regarding teaching that skill part rather than a scientist part. I'm not a scientist, but I'm basically a technician who wants to make things easy for others to practice. So I would say in a very simple way, I'm the person who teach anatomy, because every surgeon knows what to be done later.
Yes.
Simply, I always say that.
Yeah. So, you said you were doing some tough cases, difficult cases, challenging cases. In urology, stones and prostate make the bread and butter. They give you new clients, they give you a bulk of patients, but the challenging cases, they give you a kick. At the same time, a personal satisfaction, which few people want to have. What is the cost of that kick? And how many times did you have to, or did you actually feel that I shouldn't have touched this case, or this patient would have been rather left untouched? How many times did it happen, and what were those moments?
See, you're basically a craft master. So you don't expect yourself to be 100% perfect.
Agreed.
So we expecting ourselves to be the best all the time is not correct.
Okay.
Things may go wrong because of there are two things which I always say surgical problems happen because of two reasons. One is ignorance of you or arrogance of you.
Yeah.
So both of the things have to be kept in control at some point of time.
Correct.
So at any point of time when we start doing it, we always think that it will end result will be great on all the time. No problem. But sometimes it goes wrong.
Okay.
I understand. There are surgical listed complications all the time.
Yeah.
There's no doubt about it. But most of the complications happen because you don't know about it, or you're arrogant about the situation there. So if you retrospect, you always think that wish this complication should have not happened. I would have been more knowledgeful about it, or I would have been into my limitations. Had it not, the complication would have not happened.
Yeah.
It's a learning lesson for every surgeon happening all through his life. So I don't think if somebody says I never had that sort of a situation, then he has not done any surgery.
Or he's bluffing.
So he is bluffing. So I always say I can't remember how many cases, how many cases I have done so that it taught you something. No, it is always happens day to day or every time. There is the outcome might not be the way you expect. Even a minor outcome also, you always feel that duty free. Like I tell you, any patient who had some sort of a PCNL procedure, he develops a fever. So you start analyzing, why this guy had a fever? Was it the preoperative urine culture which was sterile? You never treated the urine infection, or your puncture technique was wrong. You traumatized the tissue, you perforated the pelvis, you excavated the urine, you created more hematoma. So fever is a fever, but the limiting factor. So as a surgeon, I expect everybody to backtrack. Everything has to be a reverse analysis of every situation, so that you find an answer. On the day you find an answer, you're a happy man tomorrow. But if you don't try to do that, or you can't find an answer, you can have the same situation coming back to you. So you have to find these situations happening in your life. You can't escape it.
Yeah.
If you are escaping, means you are not doing any surgeries.
Got it.
So this is a common thing. But the retrospect, you need to say, the actual thing what you need to say is, you asked me, why did I touch this case? Right? I tell you an example which I always remember throughout my life.
Okay.
Name. I don't need to tell, I can say that name also. 1998, Annapurnamma. She's a tumor, came with hematuria, had a right renal tumor going right into the IVC.
Okay.
Just just below the level of hepatic veins. And you know the private infrastructure, how much it was to operate this case at
1998 is during your freelance days.
Freelance days, I'm in Satyak India Center.
Okay.
So this patient came with hematuria.
Okay.
So I said, you require surgery, Amma, I'll be operating you.
Okay.
Fine. We didn't have ventilators, we didn't have cardiac setups at that point of time. But I was confident I should be able to operate.
Okay.
So I convinced her, saying that you get operated, you'll become all right. You see, that's where I made a mistake. Convinced her.
Okay.
See, retrospect, why I tell you, you'll know, you'll understand. Okay. She said, his only son, he's getting married. Let me see after 5 months. Anyways, marriage is there after 3 months. I'll come back after 5 months. I said, no, not a stage. You get operated.
Correct.
Fine. I did that surgery. On the table, in fact, at the time, the primitive instrumentation, I passed a Foley's catheter inside, inflate the balloon, and withdraw the whole thrombus, repaired everything. Patient went home on the 4th day or the 6th day. Fantastic. I was so elated. In fact, we went ahead and had a party because we could do that case that time. Okay.
It's a big case
Big
even
case
in these
at that
days.
time. I asked my Krishna Kumar, cardiothoracic surgeon, was there at that time. He was colleague to me in Mahavir, so I asked his help, be there in the OT. So he was there in the OT at that point of time. Well, we finished that surgery. 1 year later, she came to my OP.
Okay.
And she came in a wheelchair and she was abusing me.
Okay.
She was abusing me. I didn't realize what, she's alive and she's all right now.
Yeah.
I was very, very aghast at that point of time. And after that, and she started crying.
Okay.
I said, okay, you calm down. I asked her to take her away, and asked the attender, who is one of the cousins, because she has only one son, no husband and all.
Yeah.
She said, she said the story of it. And then the story was, after the marriage, the son and the daughter were going on a honeymoon trip from Mysore to Kooty. They had an accident and both were killed.
Okay.
So I called her and said, I asked you to leave me alone on that day. Had you left alone, I would have not seen this day.
Oh.
You made me alive, and I have to suffer all through my life with that thing, without anybody, living alone in this world. So what have you done here? You thought you had done a great thing. You've done a great surgical outcome.
Okay.
You've given a great outcome regarding the disease is concerned. But was it the right outcome for her in our wiser way?
For her.
For
not
her.
the disease.
Not the disease. So what teaches you in thing is not disease.
Yeah.
What teaches is the human being. So learn from the patient not about the disease alone, but about the rest of the holistic determination around her. So that will teach you when. So I'll always say, after that I changed. I never said I convinced you.
Okay.
So I never try to convince anybody. That changed my perspective. It is not you to get convincing the patient to get operated. It is them to get convinced about the disease to get themselves operated upon.
Correct.
So you give whole information to them, ifs and buts, betters and bats of what is the result of this procedure. But it is there to get convinced that they need to get operated. When you try to convince, this is what may happen.
So this brings us to the fact that around the disease there is a whole patient.
There is
much
more.
Yeah. And around the patient there is a whole family.
There's much more.
So we are not treating a disease, we are treating a family.
I understand. This is exactly what I'm trying to say, because we lack that empathy nowadays. We are losing that completely. We don't have. See, there, in a fast world, if somebody comes and sits in front of you, how many times you know what is he doing? You hardly. We don't even ask him. You always see the X-ray. Oh, you have a stone. You need to get operated. We take it out and see. Am I right? And you are looking at converting or possibly expecting him to answer when he wants to get operated.
Yes.
Am I right or wrong?
Yes.
So I tell you an example. When somebody comes and says, a farmer coming from a rural area, he comes there and sits down and says that he has got a stone.
Okay.
And he has got a small 2 centimeter stone inside the pelvis of the kidney.
Okay.
He can get operated after 20 days also. But you say that better not, you may get infected, you better may get pain, you may be incapacitated to get operated.
Yeah.
But if you go into his detail, you come into his shoes and say, what you do? I'm a farmer, sir. What is the present situation? It's, sir, paddy as you put, it is just for cutting for the next 3 days. If I don't cut, there is a rain and all, it will go away. What is that situation? If you really understand that situation, what will you feel? Go, finish that job and come back. Am I right or wrong? How much time we are spending that amount of time with the patient? For some reason, we are getting busy. Sometimes the patient also feels, what is this nonsense he is asking around? But the actual patient whom we will not be able to, will not be identify and take this all parameters into picture. Am I right or wrong? So
sir, absolutely.
This is one thing which we should realize. Possibly we are losing it because of our fast track world and the amount of work we are doing it. But possibly somewhere or other we need to get back into that shoes of the patient and understand the patient as a patient. Don't identify him as a disease. That these are days where we identify the people with a phone number rather than as a human being. So you are also changing.
Yes. So can you recall any moments where you were badly stuck with a case on table? The patient was bleeding or you're not able to proceed and there is nobody else to bail you out? And could you get out of that situation by yourself, or you had to abandon the case? Any such case which can recall?
No, there is nothing like abandoning the case. You need to seek a help, that's all. There's nothing like abandoning.
There is nobody to bail you out as well.
No, you need to come to a conclusion. If you are not able to come to a conclusion, better don't touch it.
Exactly, so that's the point. Preparedness.
You should be prepared for everything. So it is always there. It is always happens. And you should be prepared well. If so, but there may be a little delay, but you should be able to mentally get prepared to do that. And there is always, with the present day in Hyderabad like city, there is always people to help you. You are not in a remote corner of the place. If you are in a remote corner, you should be wise enough what you can bail out and what you cannot bail out.
Correct.
So one of the rare causes of a problem which nobody can think about, but on a regular basis, what you need to think about, you should be aware of it and you should be able to have that confidence that you can come out of it.
Again, ignorance and arrogance.
That's it. Either you are ignorant about the problem or you are arrogant about your capabilities.
Okay. So I'll ask another side of the same question. How difficult is it to manage the mess or a problem or the inability, surgical inability or a clinical inability or some administrative inability created by your colleagues in your team or in your past place of work or current place of work? How difficult is it for you to manage? Do you take it as a challenge or do you take it as a nuisance? And how often does it happen?
You see, we are all human beings. We may also create nuisances. So let's not blame it. You see, basically you will be creating yourself into two things again. When you look at and you will understand whether it was done by ignorance or an arrogance. Arrogance teaches him, ignorance makes him wiser.
Okay.
Right? So, irrespective, it's same for us also. Even if I create it, at the same time, I'll also become very careful. So, this is a part of life. I cannot say that it will be difficult, but being now at this seniority of my career, possibly I do get these situations very often. And with full respect to them. I don't say that. I can see that what would have gone wrong. With the full respect to them, I say that at least he's courteous enough. Two things which I say. You can't get away with a complication. You should know when you can stop.
Correct.
And you ask for a help for somebody else. So you should know. Somebody comes, it's a very common thing. Somebody attempted a ureteroscopy for a small stone and suddenly they are not able to pass a ureteroscope into the ureter and they didn't take out the stone, and the patient will say he's very angry that they didn't do the stone removal. I always tell them, be happy. Be happy that he knew his limitations and restricted himself to his limitation. I appreciate that man who did no more damage than, if not good. So that is a basic thing. Rather than doing a mess, trying to attempt and do much more damage, it's better to have an intact system with less amount of damage coming back to a person who can manage it in other way. So you should know your limitations. Nothing more than that, and it can happen to anybody. I don't consider that it is wrong that they cannot do it. That's the reason why they don't know. It can happen with anyone. Nobody is protected from this sort of a problem.
So it boils down to the fact that we're all humans.
Yeah, absolutely. We are humans. Try to understand.
Yeah.
You see, boss, come on. This is a craft.
Yeah.
It's a craft. When you're doing a craft, you require so many other factors to be playing with you. Why do the people, a fellow who's writing a film script goes to Thailand, sits in a beach without anything and writes a film script just because he wants some sort of a peace of mind? So thoughts can flow on. Can you have that sort of a thing?
No, we can never have such a leverage.
You can have a problem sitting in your house. You can have a problem sitting in your hospital. You may have a problem with sitting with your taxation. You may have a problem with sitting with your vehicle or your children or anything. Irrespective of all these things, your output in a given scenario which is given every day in your operation theater has to be the same. It's not possible. There is some element of pressure which happens because of it. As the time passes by, we may get immune with it or get adjusted to it, but there is always a thing which happens into your mind. So you get tuned to it. So that's the reason why I always say, gone are those days of individual practitioner who takes all the credit and all the headaches onto him and try to deliver with all other headaches inside him. So you need to have a team of people. So even if somebody is not able to give the best output at one point of time, the other can chip in and able to get the best outcome out of it. So this is where a team work or a team effort plays a big role.
Multiple brains working together.
Absolutely. Nobody is absolutely saint, or nobody has got no tensions and everybody forgets everything. You see, there's a logo also times. When you enter the airport cabin inside, they always say that the same thing. Please leave every other thought outside this cabin. When you enter this cabin, don't have any other thoughts. All worries outside. It is the expected thing to be done, but it's not easy. We're all humans.
So if somebody believes that he's an independent practitioner, he's not independent, I believe he's alone.
He's alone. Simply alone. He's alone.
So were there any incidents, or can you recall any of those moments where you were held accountable or you took the accountability for the wrongdoings of your staff or anyone? Something like vicarious liability, and it took a while for you to come out of it.
It is always, see, basically any problem is a problem. It's a leader's responsibility. Leader cannot shy away. Rest of the matters where went wrong is an internal discussion. But the leader has to take the...
So you have to stand in the front.
Yes, you have to be in the front. You have to be in the front and you are the person. Over a period of time, you see, basically what happens is, it's a ongoing process. For first 25 years, you are there in the front. After 25, the system comes into the front. But you are the system at that point of time. So today, I am the system. But I may not be there in front all the time. My system is there in front of
There's a system that can take care of it.
My system I created will take care of that. That is what is more important.
Fantastic, sir. So, as a clinician and as a surgeon in specific, were there any incidents where you were threatened or you were abused mentally or physically by the patients or their attendants?
It happens.
It happens.
Whenever there is a bad result, it does happen. It does happen. But I fortunately had very, very, very few. But most of the time, I was more perturbed than their abuse. I was more perturbed. Like I tell you, one of the rarest scenarios is we did a ESWL somewhere in 1997.
It's like a shockwave therapy for kidney stone.
And this guy goes into septicemia after that. I didn't do anything to him. I didn't do anything to him other than ESWL. He goes into septicemia. At that time, the only ventilator was there in Care Nampally because they started off at that time. I shifted to Care Nampally, and then that means at that time it was original care was there. I in fact, on the bed, I took my equipment, passed a stent under on ventilator because I cannot take him to the thing. And then after a few days, take out a stent removal on the bed. Ultimately, he recovered out of it, but differently. Well, you always get that difference. And so situations have to be there. You cannot say that he cannot be there. Humanly, you're emotional. How many times you scolded your son? It does happen. Your own son, you are scolded. So things happen.
Any incidences or incidents where you were sued by a patient? Any litigations?
Not
Never?
Not till
Fortunately? No.
Fortunately, not till now.
Yeah, you got it.
It
So,
can happen. See, it can happen anytime, but not.
bigger the doctor, bigger the problems.
No,
That's what I
understand.
believe.
No, not till now.
And the problems are multifold.
Always there, always
Yeah.
multifold.
Sir, how difficult or how tough is it to manage a difficult patient? What do you mean by difficult patient? Who is impatient, who is always demanding, who is a troublemonger, who is a potential litigant, who is always skeptical, who always comes or steps into your OPD with a sense of suspicion rather than faith. How do you manage such
Well, you
patients?
see, I can't differentiate a fellow who has this or who doesn't have it on the face of him.
Yeah.
He walks in.
Yes.
He may have all these thoughts inside his mind,
Yes.
but I'll not be able to differentiate. So I don't make myself keen enough to understand how is this guy. I make myself to be honest with me.
Okay.
I don't care what he is then. Till what I'm talking is the truth, and I am honest to my expression.
Okay.
It doesn't matter howsoever he looks into it. If I say I need to take an opinion of my colleague and only come to it, I'm not able to come to any conclusion. Go to the next room. He'll see him. We'll discuss and decide. It will be honest. And you don't need to give an opinion immediately on that.
Okay.
If I'm going to give an opinion which I'm very confident with, I put my word very clearly.
Okay.
Explain these are the reasons why you require. These are the reasons why you need to go through it. It is your choice. Or as I said, I'll never try to convince him. I'll give him the information completely. Completely, ifs and buts, completely.
Having said that, like you have operated a patient, let us say a regular stone case. After surgery, some pain is seen in many patients, but they make a scene out of that, abusing you or questioning your ability, saying that I'm still the same, what have you done, kind of situation. It's very difficult for a youngster to handle the situations.
I understand.
But definitely at your stature, maybe patients may not dare to talk to you that way, but they may talk behind you. So what I mean to ask is, somebody may not shout at you, but they shout at your receptionist. They may shout at your colleague. It is directly or indirectly shouting at you.
Absolutely.
How to handle such patients?
Well, there are some patients, and see, unfortunately, what happens is we presume that everybody will have the best outcomes.
Yeah.
But sometimes there are outcomes which are not expected to the expected expectations.
Correct.
Right? That
Correct.
is what not to the expectations.
Correct.
In which case, we have some troubles beyond it.
Yes.
The only way to come out of it is only communication, nothing more than that. It is only communication.
Honesty.
Communication. You see, had you been very honest before, your ability to communicate is very easy.
Correct.
The confidence at which you can communicate is only when you are honest enough. When you are not honest enough, like I do an ESWL, they have stones coming down and blocking the thing, and they say that it's paining you. I always tell them before, there is a 90% chance that all stones will go away. There is a 10% chance that you may require a repeat intervention.
Yeah.
This is one thing which you need to say.
Yes.
If there is a residual stone, suppose you did a PCNL, I always say there is a residual stone which may not trouble you. In case if it comes down into the ureter, you may have a trouble. Let's see it. But it appears to be passable. I may not do it.
Yeah.
So let's communicate and see fair enough in our own result. I don't think, and I understand for an individual practitioner, initially it becomes a very big difficulty. Like
Who
I tell
is
you,
not independent, who is alone.
the biggest choice is somebody talking about RIRS for a big stone.
Yeah.
Why he had to talk about RIRS? Because somebody else is offering an RIRS. He also has to come into the same thing.
Yeah.
Otherwise, he will not be able to get a chance to operate that patient.
Fear of missing
out. And fear of not missing out the technique. Fear of missing out the patient here.
Yeah.
That's exactly not. So that is one thing which I possibly need to restrict. I have come senior enough to restrain myself, and my people may respect my feeling, but for youngster it may be a problem. It may be a problem in near future. I think we should be clear enough in our own approach and honest in our approach so that you don't face these situations.
One very personal question, sir.
Please.
AINU is the brainchild of Dr. Mallikarjuna. Given your presence in this branch, this is an extremely busy center, even though it's a standalone specialty center. I don't know if the situation is same in the other branches of AINU, number one. Number two, how difficult is it for you, or how challenging is it for you to keep your other colleagues and associates as busy as you are? Because the ecosystem in a standalone center is pretty much different from a multi-specialty. Like I work in a multi-specialty. If I'm doing X number of cases a month, I get some 25 to 30% cases in my name, some 20-30% patients from marketing, some other patients from cross referrals in a standalone center. Unless the person is as big as Dr. Mallikarjuna or who has got a pretty long career, it's very difficult to attract and retain patients because you have the only source of getting the only source of getting patients is your credibility and the existing name in the society. How do you see that?
I think everything starts like this only, Harsha.
Okay.
To start with, it's always an individual person
Okay.
around which the system is being created.
Okay.
It's how robust is the system which makes the future.
Okay.
Right? How
Yeah.
robust is the system?
Yeah.
So, where are your values here?
Mm-hmm.
Where are your
Values.
values?
Values.
Where are your values here?
Yeah.
What is your expectation out of those values?
Mm-hmm.
How you are efficiently taking care of the need of the talent to create that or keep up that values.
Okay.
So this is a vicious cycle. This is a cycle which has to be run all the time.
Yeah,
It's all the time. It's a continuous process. It is never a static process. It's a dynamic process.
Yes.
So as I said, my life has gone to 3 decades now. Initially, it just has happened. One was a struggle for existence. 10 years has gone by
Yes.
struggle for existence.
Yes.
And the next 10 years has gone by struggle to excellence.
Okay.
Right, I wanted to do laparoscopy, I wanted to do big surgeries, etc. I've created a team for helping myself to create that aura. I can make those things happen.
Yes.
And I showed it here and there. That's it. The third thing is going to be is trying to a stage of establishing it. What I've done, I've learned something. I've created something for myself. What am I trying to do? It goes away with me. I may continue to work in a corporate, make my money, and that goes away with me. So I need to create an ecosystem wherein something can creep on and excel better than what I could achieve in my personal basis.
Got it, sir.
So that was the stage of establishment. So this is, I know, is a brainchild was happening because of that reason.
Okay.
So the last come is going to be is minus you. That means minus you.
Yeah.
You have established the ecosystem, and its ecosystem should be so strong that it self nurtures itself, continues to keep the values inside, and continues to replenish itself with whatever need of the talent is.
Okay.
So my aim job now is to create that ecosystem
Okay.
before I possibly retire or something like that. But I may not retire. I continue to be a clinician into the place, but I'll not be the major face for it. I still
Bhishma Pitamaha role.
I'll continue to be a clinician because that is my passion. Talking to my patient is always my passion.
Yes.
I may not do surgeries because I'll not be the same way like what I was 20 years ago after 75 years.
Yeah.
So I'll continue rest of the people to do it and take care of it. There are always people to do that. You see, you don't expect that it is always run by money. It is not necessary. Had it been money, people would have not been working in institutions. Taking a salary, right? So everybody is not calculated by value. There is something called value. There is something called passion regarding the profession. There is something called work culture. And number 3 is satisfaction in the work. Number 4 is remuneration. All keeps in a play because if you want to increase one, other will come down automatically. So it's a balancing equation. My aim here afterwards is to keep that balance intact so that not for me, for everybody else.
Fantastic, sir. So have you noticed any physical or mental limitations in you as you're aging?
Of course, you should. If you say that I'm same, I'm not. I'm not. I'll not. You see, I always realized at this point because I was a better surgeon possibly 10 years ago.
What was the peak?
Peak is around 45 to 50.
45 to 50.
50, 55. 45 to 55 is the peak time.
Okay.
After that, you're probably blunted by 1% every year.
Okay.
But at the same time, you're more wiser.
Yeah.
So your intelligence of wisdom starts increasing, but your physical ability starts coming down slowly. We realize that at that point. So that physical ability has to be supplemented by the people who can supplement that physical ability, who do it. At present, I restrict all my things which I am well versed with. That means where I don't need to put too much of strain on my brain to how to work it out.
Okay.
It goes onto spinal memory because of my vast experience, what I gained. So that I'll continue to do it. Anything new, very new surgery or a very new thing which has just entered into the market 2 months ago, unless otherwise it's very easy to do, I will not venture those things because there's no point me trying to learn it, experiment it, and then becoming perfect. Rather, a youngster will have a lot shorter curve of learning. Will be able to excel and get to that point faster than myself.
Yep.
So I restrain myself to what I've been good at all through. I don't want to experiment something new, which I've decided that I will not. My team people, somebody will take over on it, and they will be able to excel it better than myself.
Does it also mean you have limited yourself to performing surgeries of shorter duration or performing only the main part of a longer surgery?
I think that's a part of training. Like you see, in a long surgery, whenever in a department somebody is there's a sequential growth which happens to anybody. They start doing some segmentage. It's called incremental learning.
Yes. Methodology.
So you'll incremental learning means you do some part of operation every time. Don't do a whole operation, you fail. So some part of operation you start doing it, and that some part of the operation is given to the next person. So he'll excel first that, and next step of the operation sometime later he'll get it. This is called incremental learning. So that incremental learning is a very integral part of it. Actually, in fact, majority of the times our people start learning it in a wrong way. They claim they're given a degree, they come out into the practice and start doing surgeries and start learning out of their mistakes and look into it. But they're never groomed in this fashion. I feel the people who are under me for a long period of time will get benefited out of that opportunity. There is what is called an incremental learning, wherein I can assess their abilities and give that increments of learning process happening towards them at every point of time during this tenure. That's what I said. Nobody expects me. You want to be a good surgeon at the end of the day, take your own 10 years time to mature yourself. Don't think that you'll be a good surgeon within the 3 years. You may do 2-3 procedures very well. That doesn't mean that you establish yourself as a great surgeon. So that incremental learning over a period of time makes you more perfect. So a matured surgeon, I always define, is a fellow who doesn't need a fallback. And
define fallback here. In surgical terms, please define
fallback. Means 3 cases later, 4th case, he will be able to do a complication and he calls up somebody, what need to be done. So that is not the occasion. It is not the thing. You see, you may do it once in 500 cases, you may ask somebody's opinion. That's a different thing which you are not able to come. But in an incremental learning process over a long period of time, somebody would have noticed this complication, you would have experienced that complication, you would have maneuvered that complication. So how to avoid that complication you are mature about, and your wisdom and your muscle memory will not allow that complication to happen. That happens with time. That happens with exposure. That happens with volume. So it doesn't happen so fast. So it usually take a long period of time. So this is what I would say, that everybody will take some part of the operation at one point of time. The critical point will come only after they are able to close up to that right moment. And they are able to, I feel that they are able to do that. And probably I notice them doing it. And I see them doing it once or twice. Then I'll free them so that you can do it.
Does it mean there is no scope for an independent practice for a youngster coming into the society as a practitioner? Because like you said, if it's a methodical training, if it's incremental learning, he must be a part of a team.
Unfortunately, I would say yes. The reason why is, you are as an independent practitioner, there are 2 things which you're not getting. Number 1, you can't get the volume.
Yes, I agreed.
See, if you're doing a laparoscopic surgery twice in a month, how can I become an expert? So you're exposed to 10 cases a month. You may do 1 case in a year, but your exposure will be ultimately 120 cases. Right? So that cannot be compensated. So your learning time is going to be long, and the curve is going to be very slow because the number of volume of the cases is going to be very low. And faster the exposure, better the learning. Slower the exposure, poorer the learning. So I would say I would say yes for your question. Independent individual practitioners who are working alone. I would say alone, especially with a low volume, because
Definitely
most
low
of the time
volume.
low volume in a city. It's a low
Surgeons are
volume.
growing in number like anything.
So in which case, I would say unfortunately, yes, you might be doing that common procedures because that volume may be supplementing you, but uncommon procedures, you are still a poorer man to get operated.
Let's go deeper into the same question. How many teams are there currently in Hyderabad in any surgical specialty where good quality work is going on, and how many teams actually welcome such youngsters to be a part of the team? Because these are harsh truths, sir.
No, these are truths, but it depends upon what the leader expects and what the person works for.
The
See,
person
there are
interests
two
are
things.
always
Two things. Basically, if the denominator is money, no team will survive for long.
correct.
So that's a basic reason why it happens.
Excellence.
Most of the times. Well, you see, how many? See, excellence doesn't happen in 1 year or 2 years. It happens over 10 years. I'm telling you now. Suppose if somebody is achieving excellence, it happens only at the end of 10 years. That means the team has formed and matured.
Okay.
Am I right? If something happens over 10 years, that means it is formed and matured.
Yeah.
See, every time this is what happens. Majority of the times teams do collapse or something. It's only for denominator becomes the money.
Yeah.
But as I said, there are so many other variables inside it. Number one is the passion to do good surgeries, the passion to specialize yourself into your core specialty, where you working alone, your core may not be even once in a month or twice, one case in 2 months. So unless with a team, you will not have that volume to come up. So one is that, and number two, your another the culture at work, and number two and number three is how stressed you are at work. All these things matter. So many factors are there for a team to sustain for a long period of time. You need to look at it every time. Of course, one of the factors is also money. Everybody needs extra money. There is no doubt about it.
Definitely.
But that should not be the only reason why team has to develop.
Money should be the servant.
One of the part, not everything.
Yeah.
Not everything.
Fine. So, sir, how have you evolved over this 35 years of your experience as a surgeon and as a leader?
Well, my surgeon, as I said, I would say I'm very happy in my surgical journey.
Yeah.
I was trained as a good open surgeon when I was in residency, but I became a good endourologist during my first 10 years.
Okay.
And later, good laparoscopic surgeon later, and the last 10 years into robotics and getting into much more than actual conceptualization of urological surgery rather than how I perform for a single case. So conceptualization and making it what makes me much more happier today is how to make it simpler to the other person.
Okay.
So that concept probably I started feeling it in the last few years, last 5 to 7 years, and especially when the laparoscopic surgery came in. Okay. So that is the most enjoying part of it. So. So this is a surgical journey. So every decade there is a change, and I always expect if you don't have a change at the end of 10 years in the way you approach your career, you'll be monotonous, and that kills your abilities and your zeal to continue. So you need to have something, a purpose of life which is defined in a different fashion at every end of 10 years.
Is it out of quest to excel or quest to
No, there's nothing to. I'm not trying to excel here. Okay. I'm trying to feel myself good.
Okay.
I need to feel good. What makes me feeling good? I'm making somebody easier. Somebody comes and says, okay, this way of doing it made me much easier. I could finish it. Okay. There's no excellence in that for me. So the most satisfying for me is, okay, I could make something into the other person's life in their abilities. That is what makes me much more happier.
This answers the question as a surgeon, evolutionary surgeon.
Yes.
As a leader?
I never considered as a leader all these days, actually. But, because of my seniority, because of my ownership, I became a leader. But I still consider everybody as a part of the whole team.
So you are accepted unanimously as a leader?
I don't know.
Some 70, 80 urologists in AINU are working alongside Dr. Mallikarjuna.
There are two reasons why it can happen, because I am a majority stake guy into this, or the conceptualization happened because of me, and I risked myself to start this institution, and possibly all those reasons might be the one. But I would say as a leadership is a quality is not an authority.
Yeah.
It's not an authority.
It's creating leaders.
It's creating more leaders under you. You
Inculcating
see, you need to see the progress in them and feel happy. Then only you'll be a proper leader.
Yeah.
I don't be calling a leader if I achieve something and I boast something at the behest of my team members working behind me. Rather, if they can make something better and make themselves better, as a leader, though I am sitting in the back, I'll be feeling very, very happy about it.
100%, sir. 100%.
That is what my I developed into it. That's what is.
Yep. Sir, on a personal note, would you be happy or would you be sad if a fantastic or a terrific non-surgical alternative comes into the picture for a very popular or demanding surgery? Like, let us take the example of bladder removal for bladder cancer. It is considered to be one of the most difficult surgeries in urology. And of late, what we're seeing in medical oncology is something which is progressing towards bladder preservation. So what is your take on such things where surgical options come down at the cost of our personal satisfaction or a kick which we get as a surgeons, but definitely the patients are getting benefited? How do you see that?
I don't think I don't think why should we think about it at all. Something great happening great to the community is always a welcome. You're never, see, none of the specialties are devoid of any and if they don't get away from their work at any point of time. Like it's only thing is if you in your own journey, if I'm doing an open surgery when I was a resident, if I don't learn endourology, I would have never existed in the first 10 years of my life. If I don't learn laparoscopic urology, I would have not excelled in the next 10 years of life.
Yep.
If I had not done my establishing practice or a system here for it, I could have not excelled in creating what I felt of teaching somebody and making their lives easier by doing these surgeries. So you need to change everywhere. So whether there is a new outcome, there is a new surgery, there may not be a surgery minused away from your list, but bucket list, but still you need something more to get added, and there are so many more things which you can look into and possibly can excel on. So medicine, healthcare is never going to be obsolete at any point of time. Like even now in the IT sector, like AI is replacing. Yes, it does replace and probably automates some jobs, but there are so many jobs which are necessary in the AI itself. So the people have to modify themselves into that in that. So at every decade, you cannot be doing the same work for the next 30 years and getting the same amount of money. You need to progress in your profession, in your way of work, everything too.
So it all comes down to the point that patient first.
Patient first. Always. First. See, there's no way you can defeat that way. You cannot you cannot stop the progress happening.
Correct, sir. At this point of time, after 35 years, is there anything that makes you unhappy?
Well,
apart from the regret that you just expressed.
No, that's okay. That's a part of life. That's a part of life. But I don't think I am feeling unhappy at any point of time. Okay. But the only thing is, I'm unhappy at one level because I wish I was born at this point of time because learning was so easy.
Yeah.
Learning is so easy. For me, at that time, to learn laparoscopy, I have to travel so long to see one person.
Okay.
I used to spend between 11:30 in the night to 1 o'clock to see a lap chole done by G.V. Rao in Yashoda.
Okay.
Just to learn laparoscopy. It was so difficult and we see that cassettes used to come, get that VC cassette.
Memorize.
We have to memorize, play that cassette which is seen on a TV in a
VCR.
small thing, VCR. And learning was so difficult at that time.
Yeah.
I wish I was a little late, possibly 10 years before.
Sir, you are way ahead of your time, sir. You must ask me. Sir, we watch your surgeries on YouTube and we try to replicate them.
I would have shortened my learning curve. That's all is very great. I would have what I achieved probably for 5 years or 8 years to learn my laparoscopic skill to perfect. I would not say perfect. To achieve a reasonable skill, I would say.
Yeah.
I would have done it in 2 years had it not been.
So, is there anyone perhaps that you envy or that you have no hesitation in saying that you try to copy them or be what they are? Any person in medical field that you look up to?
The 3 people who influenced me in my life regarding being a urologist and beyond urologist. One person was in my formative stages when I was a residency.
Okay.
That was Dr. S. Vaidyanathan. He was a assistant professor at that time. And he's a man who taught me how to be a urologist. What is that urological thinking, which is different from a general surgeon?
Yeah.
So, my concept of urology was taught by me or imbibed from him.
Okay.
It was pure imbibition from him,
Okay.
which taught me that concept of urology. There are many people ask me how your concept is different.
Yeah.
So I still rate that, or possibly give the credit to him who molded me as a urologist.
Okay.
Having done my urology and coming out, my basic point was to become passionate about teaching or practicing urology, but able to teach people, or teaching as a part of my whole domain into the whole thing.
Yeah.
But that was not practical because I was struggling to exist.
Yes.
But at the same time, I found one answer there was being a person by name Dr. Mahesh Desai,
Okay.
who could even practice. He was also practicing, but he could sense that opportunity and create an environment around him to fulfill that passion what he had for that, sir. So he taught me how to practice urology.
So you went to Nadiad?
No, I have not been to India, but I learned from him. I was association with him, made me think I can also do in this fashion, which I was clueless how to achieve it, but I could see from him that it is, if you have a will, it is still possible.
Okay.
And the last thing is the man who is a mentor, philosopher, and guide to me in many aspects, in small issues sometimes, is Dr. Nageshwari Day.
Oh.
So Nagi was instrumental in me thinking much beyond urology.
Okay.
So you're a urologist. What is beyond urology? So if you define that thinking process came from Nagi.
Okay.
So if you look at these three people, these are the people who molded my career completely, both formatively, establishing and maturing myself into.
Anyone you envy?
There is none to envy because we know our limitations, our abilities.
Okay.
Looking back, I can say that I wish I could have done better than what I am today. Possibly I should have done in that fashion, but it's a retrospect.
Yeah.
There is no point thinking on retrospect, which gets you some bad taste in your mouth, but nothing more than that. You should be happy with what I achieved, and possibly I'm fine with that of what I achieved, and possibly that's what is destined to be in my life.
Yeah. So I'll take you back to the question which I asked you about AINU. It needs a lot of courage and guts to establish a standalone center in the era of multi-specialty, given the fact that, like I said, like we discussed, the footfall into a standalone specialty center is whole and soul based on the person or the credibility or the popularity of that surgeon. So how could you even think of doing something, and how could you materialize it? How could you materialize it and execute it so well?
Coming back to the history part of it,
Yeah.
the biggest disadvantage what I felt in my corporate practice at that point of time when I was in my previous, before AINU, was sustaining the department and getting the financials easy, at the same time keeping up my values. That was a very tough job because your absence is felt, and so many other reasons. And urology was a specialty during that time, possibly I would say 15 years ago or 20 years ago. There's so much of evolution, so much of investment happening, and we are not given that opportunity, or they were not allowing to, they were never allowing that investment to happen into the hospital structure. And possibly it was finding for me difficult for me to even approach them and to get those equipment necessary. Nowadays, every hospital is pushing that equipment because they found it is a mandatory thing, but they never felt mandatory at that point of time. Everybody is looking at what is the return I get out of the investment, etc.
Agreed.
Well, that was a difficult choice for me at that point of time. At that time, Nagi suggested, if money is not your basic aim, you are capable with your whatever goodwill you have created into the society, you are capable of starting your own institution, building an ecosystem around you, investing whatever the way you require to do it, and creating it profitable also. And he connected me to one or two people who are already AVCs, who are investors into AIG. So that idea came up somewhere around 2011. Materialized by 2013, and we started this institution in 2013. But at that point of time, the basic idea is to build a world-class institution for kidney diseases alone, and it should be so good. For that, this old building itself was big enough at that point of time. Everybody commented me saying that, are you going to think about doing this? It looks like it's such a big building. Are you sure about you are able to manage it?
Yeah.
But luckily, God has been kind. We could stitch a good fabric of the team.
Yeah.
And then we were successful in creating that values and possibly getting that outcomes to the patient. What we believed is you do good work, good outcomes, money becomes the byproduct. That was my chairman saying at that point of time.
Okay.
You just do good work. Money automatically comes. Nobody is saying money. We are not asking you to earn money.
Yeah.
You do good work, money automatically comes. That was the philosophy with which we started off. But anyway, any business or any entrepreneurship or any enterprise will, over a period of time, it has got its natural growth that should happen.
Okay.
Okay, in a urology like specialty, I can't add another 5 floors and put more beds. It doesn't make any sense because it is of no use.
Yeah.
So that's how, when the concept of a single specialty worked out in our favor for the first 7 or 8 years, wherein there is a lot of investment which is done into the equipment, we are eyeing that investment ability to serve that extra mile, extra better outcomes without spending too much of money in a corporate style, and still getting that outcomes here in this sort of an institution. I thought it should be replicable in the same fashion if the same sort of a thought process is there in the people who are going to work in those places.
Value driven
And possibly outcome driven. Finance becomes the rest part of it. I never say that you cannot be doing charity everywhere and still run the institution.
Absolutely.
So that's how the thought process started, and we expanded our institutions to many other places. But the same principle holds true, wherein we always see that people who are keen on creating those values and change the outcomes and better service or better things, just not to earn money.
Yeah.
Just not to earn money. Money is mandatory. Otherwise, growth doesn't happen. You can't get a new equipment if you don't earn. So, money is mandatory. There is an investor who is invested on you, expecting money out of it also. But he doesn't want you to do an unscrupulous thing to get into it. So, we never encourage that sort of an unscrupulous activity, unindicated, unethical practice at any point of time. So, do a good serve. Think about the outcome. Think about the patient first basis, and money becomes the second byproduct of it. So, that's a necessity at that point of time for me, which made me to start AINU after Nagi advised me, and later the natural growth took it to whatever stage it is today.
Yes. Having said that, sir, the kind of quality work that you perform in your hospital every single day, you're bound to come across complications. You're bound to come across some mishaps. How difficult is it for you in particular and anybody in general to pull up and keep working on a day where a disaster has happened? Number one. Number two, how difficult is it for you to redo the same procedure next time?
This happens with everyone at every point of time.
Yes.
I don't say that it doesn't happen, but there may be initial, if the similar case comes in the next 1 month, you may have a little inhibition in doing that. But over a period of time, forgetting is a part of life. If forgetting is not there, you cannot be alive.
We have chosen a profession which is bound to
have this sort of an issues.
Yes.
That may be related to the patient, host, disease, and the surgeon. All process, the patient itself, the disease process, or the surgeon. All three together.
The stakeholders in a disease process.
These are the three stakeholders basically. These are the three stakeholders which can result into that sort of an outcome.
Yes.
But that should not dissuade you from doing it in next time, because it is once. Probably first, second, third occasions you are a little cautious, but it doesn't change the actual style of your work or the outcome. But basically it satisfies you by being cautious that you are making an attempt not to get into that sort of a complication next time. But it is a part of your game. There's no other way.
Yeah, we can't escape.
We can't escape.
We must keep doing the same thing. Sir, for an athlete, it's an Olympic medal or a World Cup. What is it for you? The ultimate achievement? Or does a doctor have something called an ultimate achievement?
That's what, again, we come back to the same thing. What satisfies you?
Yeah.
Right, what satisfies you?
Okay.
Somebody asked me, you have been doing 35 years, you're doing the same job. What else we are doing? Nothing new, probably. The way we do it, laparoscopically, open surgery, but ultimately what we do inside for the disease process is almost the same. Nothing has changed.
Yes.
But we get a little satisfaction by doing in a new technique, something new which we have not done in the last 15 years, in the new way, and you replicate it, you feel happy regarding your capability, etc.
Okay.
Number two, you get more happy when somebody you taught him are able to replicate it and you made his life easier in making this possible. That makes you happy.
Correct.
Number 3, somebody comes and tells you, you made my life easier, and they say thanks you to you,
Yes,
which makes
yes,
it.
yes.
And ultimately, which runs you every day to do the same job again is a satisfied patient or a patient attender coming back to you and thanking you in spite of you being paid. It is that extra effort what they are doing for making you feel good by saying that thanks,
Correct,
which
sir.
keeps you alive and do the same job again tomorrow.
Happy patients, happy doctors.
Happy doctors, not by money alone,
Yeah, yeah,
but by inner feeling and emotion.
Always, sir. Agreed. So, sir, last question. Given a chance to revisit your youth or when you were like 40, okay, when you're doing very good surgical work, is there anything that you would want to change or you hope and or you believe you could have changed to make yourself a better person?
No, that is not in 40s, in my formative years. Actually, everybody, with my attitude and the way I was trained in open surgery, I had an option of taking 2 interviews after my MS. One was in urology, another was for surgical oncology in Adyar.
Mm-hmm. Surgical oncology in Nadiad.
Adyar.
Okay.
Adyar.
Yeah.
I had an interview. So
Okay.
these are the 2 interviews I have to attend.
Okay.
So at that time, as I said, we were just living with the stipend, nothing more than that.
Yeah.
I finished my interview in urology was first, and I was selected already.
Okay.
And to come to Chennai again, I have to take 2 trains from Chandigarh to Chennai for 2 days or 3 days, and come back again from Chennai to Chandigarh at that point of time. I felt okay. I have something in my hand. That's enough. I don't need to try for it. But
Okay.
looking back regarding my personality and my abilities on open surgery at that point of time and my attitude towards surgery, I would have been a better surgical oncologist, I feel, had it been that I would have done surgical oncology at that point of time.
Sir, let me tell you something. You can complete your answer. I was in Tata Memorial. Surgical oncology residents in Tata Memorial, they watch your YouTube videos and they operate. I'm not kidding, sir.
I understand.
So,
No, that is a surgical procedure. What I meant to say is it's based on what you not do it. What you say is how your inbuilt attitude is towards.
yeah.
Like my attitude was that extirpation I was very good at even during my general surgery days. So I thought so. Probably I may not. The things have changed now. Surgical oncology has become laparoscopy. We are all doing a lot of urological oncology
yes.
also. So I don't say that. So that was the only thing. Had it been probably good, had it been in a surgical oncology. No regrets even being a urologist at that point of time. I don't really regret. But the reason for selection was I felt the urology department was very good in PGI.
Okay.
Plastic surgery people were asking me to apply, but I didn't apply because I was never suited for plastic surgery. Urology was very good. So you get impressed.
What do you mean by never suited for plastic surgery?
I was never mentally not. As I said, now I'm an extirpative surgeon. I'm not such a sort of a plastic aesthetic guy of a thing. So that I didn't even go to the interview. Though I was called for the interview, I didn't even go. So urology, I went there.
Okay.
Because I was impressed with the urology work at that time, being a general surgery resident. Not because at that time we had very limited procedures, some flavor to urology you don't develop in 3 years.
Yeah.
Am I right? We all presume that I'm looking at kidney diseases, doctor being because I like kidney disease being treated. No, these all we get those ideas because the way the work culture is there in the department, how your bosses were there at that point of time in that department, how the teaching is there in the department, what sort of a surgeries residents was getting. That makes your decision much easier.
Yeah.
So for that reason, I went into urology. Actually, frankly speaking, I was supposed to become a vascular surgeon. I finished my general surgery and then joined vascular surgery.
You said your SRship in
general surgery and vascular surgery. And I was a senior resident vascular surgery on call for 24/7 for the next 1.5 years.
Oh.
So at that time, had my boss, S.K. Khanna at that time, would have created a lecturership in vascular surgery, I would have been retained in vascular surgery at that time. He failed in creating that job.
Okay.
As a lecturer in vascular surgery. There was no MCH in vascular surgery at that time.
Okay.
So it came later after a few years in Chennai at that time. So I was akin to be an vascular surgeon. He failed, so I made my decision to go for another specialization and then join urology.
And you would have happily been a vascular surgeon.
Absolutely. Vascular surgery was my passion at that time.
Oh.
Even my thesis, general surgery thesis was in vascular surgery.
Sir, I think one podcast is never enough for a guy like you, because I have tried to bring out a lot of scars or miseries or whatever you have gone through, but it's a textbook, sir. And I strongly believe we ourselves stand as a role model for ourselves, because our life itself teaches us a lot more than what other people can teach you. And you, as a leader, as a urologist in Hyderabad, you are a source of inspiration to many youngsters, sir, for generations to come. And today I'm a changed man with the kind of interview that I have had with you, and fantastic opportunity. Thanks a lot for your time. And
My last dialogue is always there.
Sir,
Always I
please.
say, if somebody is inspiring you, there is
Sir.
a lot of perspiration which has gone behind him.
Absolutely, sir. Absolutely. Can't agree anymore.
That's
Thank you, sir. Thanks a lot for your time, sir.
wonderful. Very nice talking to you, Harsha.
Thank you,
All
sir.
the best.
Thanks a lot, sir. Thank you, sir. Bye, sir.